Hello everyone, welcome back to our channel. In today's video, we're going to talk about a very important topic, the best diet to follow when recovering from malaria. Malaria is a serious illness caused by parasites transmitted through the bites of infected mosquitoes. It can cause a range of symptoms, including fever, chills, and flu-like illness. If not treated promptly, it can lead to severe complications. Along with medical treatment, diet plays a crucial role in recovery. So, let's dive into what you should eat and what to avoid to recover from malaria as quickly as possible.
Malaria is associated with high-grade fever and is transmitted by the bite of an Anopheles mosquito. It is that time of the year again. The monsoon showers are here to take all our summer troubles away. The arrival of the much-awaited rains has also triggered a bevy of infections and diseases. Malaria is one of the most common vector-borne diseases which can prove to be fatal if not taken care of in time. It is associated with high-grade fever and is transmitted by the bite of an Anopheles mosquito. This mosquito transports the parasites from one infected person to another. They eventually enter the bloodstream, infecting the red blood cells. Did you know, according to USAID.gov, in the United States, malaria is primarily an imported disease, with approximately 2,000 cases reported annually. The malaria transmission in the United States is limited to certain regions, including parts of Hawaii, Puerto Rico, and the U.S. Virgin Islands. And the most effective way to prevent malaria is by taking anti-malarial drugs before, during, and after travel to malaria-endemic areas. In the United States, the majority of malaria cases are caused by the Plasmodium falciparum parasite, which is the most severe form of malaria. Pregnant women are at an increased risk of severe malaria and adverse outcomes for both the mother and the baby. Common symptoms of malaria are headache, fever, fatigue, muscle pain, back pain, chills, sweating, dry cough, enlargement of the liver, and vomiting. In some cases of a more severe kind, other organs get involved and there could be severe blood loss, hypoglycemia, kidney failure, respiratory involvement, cerebral malaria, jaundice, loss of consciousness, and even death. Treatment of malaria. Treatment includes various drugs recommended by the World Health Organization, WHO, and the severity of the ongoing infection. However, there is no vaccination for prevention of malaria, and preventive therapy is dictated by the place of origin and by your doctor's advice. If you are infected by the malarial parasite, eating a healthy diet becomes the cornerstone for fast and healthy recovery and to fight the infection. Food keeps the body fueled to fight of the parasite attack. Our immune system must be fed well to fight well. Good nutrition is an established prerequisite for quick and safe recovery. The medications may boost our internal system to fight back, but fueling our body with healthy foods will make our system work more efficiently. We really don't feel like eating when we are unwell. Therefore, to make it easy for you, here are a few pointers to keep in mind when you have suffering from malaria. Foods to eat while treating malaria. Number 1, energy-giving foods. Simple sources of carbohydrates that do not need much digestion and provide instant energy are at the top of the list. With a low appetite and bouts of fever, you need to refuel the body fast. Glucose water, electrolyte, sugarcane juice, coconut water, sherbets of rose, orange squash are instant energy drinks that replenish fluids and provide energy. Toffees, chocolates, ice creams are other items that can be added to the list. Chilled foods also help reduce nausea. Number 2, load up on proteins. Proteins are a must-have as our immune system feeds on proteins, and foods like dals, chicken, and eggs are some of the right options to add to your diet. Dals can be made into a soup and flavored with lemon. Cakes are a good way to consume eggs when appetite is low and taste buds need to be cajoled. Milk, lassi, and yogurt add not just proteins but valuable minerals. Yogurt also adds probiotics, which help overcome gastric symptoms and improve taste and digestion. Number 3, include vitamins in your diet. Vitamins from fruits, fresh fruit juices, help not just the immune system but also are good sources of energy and electrolytes. Citrus fruits help fight the infection with vitamin C. Red and yellow fruits help add vitamin A, which is a crucial nutrient for our immune system and a potent antioxidant. Fruits like guava add both vitamin C and iron to help build up RBCs. Number 4, have nuts and seeds. Nuts and seeds are small powerhouses of several healthy nutrients, along with healthy fats and proteins. Soaked almonds, or crushed almond in milk, give a lot in small amounts. They are also rich in phytonutrients, which help fight the antioxidant stress caused by the infection. Furthermore, check out the best fruits for malaria patients that can promote healing and lead to a quicker recovery from this disease in this health education channel. Which fruit is good for malaria patient? Fruits contain important vitamins and minerals like vitamins C, A, E, and several antioxidants. Most of them are considered functional foods, which indicates that they can help in the treatment of various diseases and infections. Diseases like malaria can lower the body's immunity and cause delays in recovery, so it is highly recommended to consume fruits and vegetables during this condition. Supplementation, mainly with vitamins A and D, is advantageous. This provides a potential and beneficial strategy for the prophylactic application of vitamins and the prevention of malaria, says research conducted in May 2022. Here is a list of top fruits that can help in the treatment and faster recovery of malaria. Number 1. Apples. Diarrhea is quite common in malaria, and apples can be helpful for that. They include pectin, which aids in the treatment of diarrhea and constipation by bulking up the stool. Apples also contain compounds that appear to be capable of killing germs. Moreover, ursolic acid, found in apple peel, is thought to play a function in muscle growth and metabolism. You can give apple slices to malaria patients or apple juice depending on their condition. Lastly, malaria fever can also be reduced with apple cider vinegar. Soak a cloth in apple cider vinegar diluted with water. For 10 minutes, place it on your brow. Number 2. Berries. Berries have antioxidants and are high in vitamin C, both of which are great for building immunity. The presence of polyphenol chemicals, which have been associated with health benefits, is primarily responsible for the antioxidant action. You can eat strawberries, blueberries, or any other berries available in your area. Researchers from the University of Campinas in Brazil and Texas A&M University in the United States discovered that aca berries lower parasite levels that cause malaria in malaria-infected mice. Number 3. Papaya, also called pawpaw. Not only the fruit is beneficial, but also the extracted papaya leaf juice has anti-malarial properties and is beneficial in increasing the platelets count, which can be done naturally rather than depending on any medications for the same. Benefits of papaya fruit and its leaves to treat malaria or dengue. Papaya leaves include phenolic chemicals, papain, and alkaloids, which function as powerful antioxidants and boost the body's immunity. This is the reason they are popularly used for the treatment of malaria and dengue. You can eat ripe or unripe papaya as it is, or make papaya leaf juice or shake it for the treatment of malaria. However, consult a doctor before eating unripe papaya if you are pregnant or breastfeeding. Number 4. Grapes. Resveratrol, a chemical found in the skin of black grapes, may aid in the treatment of malaria, according to experts in the United States. It may protect against cancer by lowering inflammation and inhibiting cancer cell development. Grapes also include catechins, quercetin, and anthocyanins, which are antioxidants that may work together to fight diseases. Vitamin C is another important nutrient found in grapes that can improve immunity and help in the faster recovery of malaria. Number 5. Oranges. Another vitamin C-rich fruit that can help in the treatment of malaria is orange. They are abundant in carotenoid antioxidants, which give them vibrant orange, red, and yellow hues. According to one study, drinking fresh orange juice helped raise skin carotenoid levels, which are good markers of the body's total antioxidant health. Number 6. Carrots. Rich in beta-carotene, which the body converts into vitamin A, carrots support the immune system and promote healthy skin and mucous membranes, which can be a first line of defense against infections. In conclusions, fruits are high in vitamins, minerals, and antioxidants that help the body recover from various diseases. The best fruits for malaria include apples, oranges, berries, grapes, and papaya due to their high vitamin C and antioxidant content. They are foods to avoid while treating malaria. Number 1. High fiber food. Very high fiber foods may not sit well in your tummy, so give it a break. Whole grains, whole dals, and vegetables with tough fibers may cause gas and indigestion. Number 2. Spicy food and sauces. Avoid very spicy and rich sauces. The chatpata food may sound good, but it could trigger a reaction because of the medication you are taking. Number 3. Junk food. This one is a no-brainer. Junk food is a big no when you are suffering from malaria. Having junk food may even worsen your condition. Junk food is not healthy for a normal body, and during illness, it may wreak havoc.
Now, let's talk about tips to keep your kidneys safe if you have malaria. Number 1. Do not take any medications which are not prescribed by a doctor who has seen you in detail prior to prescribing the medications. Number 2. In case of fever, hydrate yourself well and get tested for the cause of fever, as treating the cause can save you from complications. Number 3. If malaria has been diagnosed, start treatment immediately under guidance of your doctor. Number 4. Sometimes, The doctor may suggest admission to the hospital if your symptoms are suggestive of severe or complicated malaria, which can require intravenous medications, fluids, and supportive care in the hospital, and prevent it becoming life-threatening. Do not delay. Start the required treatment in time. Number 5. Avoid alternative therapies and strong painkillers in a fever or an established malaria situation, as it can rapidly damage kidneys. Always remember that the information and materials included on this channel are for educational and general purposes only and are not intended to be substitutes for medical treatment by a healthcare professional. Due to unique individual needs, the viewers should consult their physicians to determine the appropriateness of the information for the viewer's situation. Please, if you have or suspect a medical or health problem, promptly contact your healthcare provider. Thank you for watching. If you found this video helpful, don't forget to like, comment, and subscribe to our channel for more health and wellness tips. Stay healthy and take care.